stop my video and so that you can concentrate on the screen. Uh, or I'll just keep it running. I think that's better. So, introduction to medical research and navigating the path to discovery. It's basically just you discovering what is important for you. So, that's it. Why research matters? So, research is primarily what we use to connect with other people. For medical students at your level, or for medical students at our level, or for medical graduates, or of people that are just in the medical field generally, and they want to be clinicians. They don't want to be researchers specifically. So, what is the most important? What is the importance of research for them who don't want to just pursue research as a professional uh, career? Is that research is going to help you connect with people, right? Research is going to help you to expand your network essentially. Now, there are very few ways in which you can approach a professor or assistant professor or a resident, especially someone who's not in your country, and approach them and then ask them to help you in any way, to give you an observership or to give you a rotation or to connect you to anyone else or to vouch for you. So you have to first work with them on any project, right? And what project can you work with them? Like, what is the project that you can work with them? And that is research, right? If they are someone who is senior than you, then you obviously cannot be with them in any academic project. So research is primarily, for me personally, it's a network tool. So networking is the primary uh, benefit of research and why I think you should learn it. Of course, uh, there are other benefits as well. You get to know about evidence-based practice. You get to know about the latest guidelines. You get to develop a skill of interpreting data or to understand the results that are written in the paper, or to understand to understand the words and then derive the interpretation of it. You develop a skill that's basically a skill, right? You're reading a paper and then you are um, basically describing what is written there and basically using it in your daily practice. So, of course, it makes you better as a clinician as well. That is why research is highly pushed in good academic uh, settings. So, this is how a research is basically conducted, right? Any kind of a study design. So, let me talk about study. I'll talk about study designs after this, but any study that you're doing, except for I think a letter to the editor or case study, any original study or observational study you're doing, any clinical trial you're doing, any study which involves writing a manuscript, this is the all the steps that are going to be followed. Whether you're writing a cross section, whether you're writing a systematic review, whether you're writing a narrative review, whether you're writing a review article, whether you're writing a clinical trial, you always have to follow these steps. Now there can be some changing, like for example, if you're writing cross-sectional, uh, you don't want to do meta-analysis. You're just going to do simple descriptive analysis. So there are just going to be a few changes, and most of the framework is going to stay the same. The PICO model, the literature search, design study, data collection, writing, and peer review. We are going to discuss uh, mainly formulating a question and literature search and design study. We're not going to discuss about data collection and writing because then this would not be a basic workshop, right? This is just going to go to the advanced level. So we're just going to discuss the first three, and we are going to tell you how to begin your research. So if you are more than half the way of your project, you can just go all the way on your own. Then you wouldn't need any other guidance. So this is where we talk about the study designs, the different study designs. So hierarchy of evidence is just basically a figure which shows us that which study gives us the highest evidence-based uh, results and which study gives us the lowest evidence-based results. Like Of course, doing research eventually, why we do research, generally, not talking about us, is that we want to uh, incorporate some new knowledge in the medical field, right? If you're not incorporating any new knowledge, we're not putting in any new evidence, we're not putting in any new guideline, why are we doing research? So that is why the study designs are divided on the fact that which study design gives us the most evidence, right? So I'm just going to show you this diagram zoomed in. I hope you can see this clearly now. Systematic reviews are at the top, and uh, case series, case reports, observational studies, they're at the bottom, right? So this figure does not necessarily mean that systematic reviews are the best and let's say something like a case series is the worst. That's not what this figure is trying to show. This is what many institutes try to sell you, that this is this is the case, that systematic reviews are the best. That's not what this figure is showing. It's just showing that systematic reviews provide the best evidence. Does that make it the best study for you? Not necessarily, because systematic reviews are good if you are a student, if you can't travel, but if you are a clinician, you are expected to do randomized control trials in the hospital, or non-randomized control trials, or case reports and case studies, because these studies are on field studies. They have much more worth. They are offered fundings. They are offered. Uh, they involve more people. They involve large teams, right? So this these studies are more important. So if you are a medical graduate and you've participated in a clinical trial, that is going to show up on your profile more than doing 10 systematic reviews. So you got to have that in mind, keep that in mind, that nobody actually tells you that. But as a student, if you really can't travel anywhere and if you want to conduct the research easily, you can go for systematic reviews. But this triangle doesn't mean which study is the best, it just means that which study provides the most evidence. Right? Our cities, in my opinion, are the best uh, as a clinician if you want to progress. So, getting started, you have to identify your interest. And, guys, this meeting might end in between, so I'm just going to send you another link if that happens. But yes, going to send you guys another link, okay? So, you can't haphazardly just start research, right? If you go into any institute and pay them and they just add you to a bunch of researchers, you have to first understand that doing 10 researches in every specialty is not going to do much for your application. We are talking about USMLE, and we're also talking about generally as a student what will inspire interest in you. You have to identify the specialty which attracts you. Like, so if you are not of medicine, you can't do research in medicine. I mean, if you want to, you can, but see, that has two disadvantages. First disadvantage is that it is not going to incite any curiosity in you. You won't be interested in doing that. You're just going to do that for a publication. And the second disadvantage it's going to present is that it will not enhance your application in any way. Okay, so if you are planning to match in internal medicine, you have to conduct research in internal medicine. If you're planning to match in general surgery, you have to conduct research in general surgery. Okay, and then you have to find a mentor. This is very important. I mean, this is the thing that you are paying for essentially when you're going into any institute for research. Is this you have to find a mentor, right, to guide you. You can also learn the tools from YouTube, EndNote, Zotero. These are some of the resources. You can learn them and present them. But I think going for the mentor is basically the main thing. And after you've went for the mentor can tell you what you want to learn. But there are resources that you can learn. We're going to discuss them further on. You can also go for the easy studies, easy as in studies which don't require a lot of teamwork or mentor or anything, right? But I believe that if you are investing your time, you should invest it in something worthwhile. So these are some resources. Okay, uh, These are some databases: PubMed, Google Scholar, Mesh database, Zotero. Zotero is for organization; it's not for searching. For writing and analysis, you can use SPSS, R, Python, and you can use Overleaf. These are basically applications, so you don't have to get confused on what this all of this is. PubMed and Google Scholar, you must know these are databases, and all of these others are applications. And for screening, you can use Ryan AI, which is a website, and you can also use Zotero, but we usually use Ryan for that. I'm not going to go into detail of these resources because then again, this is not going to be a basic level workshop. I just want you to feel good about starting after this workshop. That's what you have to take uh, care. Now, IRB, first of all, what it is basically a board, a review board. It basically is mini organization in whichever institute you are studying or working, which basically has the responsibility of providing you the permission to perform research there, right? So they basically review your research. You uh, present your plan to them, you present your questionnaire, and you present everything to them, and they review it. This is at the start of the research, right? This is at the start before starting. Yeah, they review everything, and then they give you the permission to carry it out. Okay, so if you are in JSMU, you need the approval of JSMU. If you are in JPMC, you need approval of JPMC. In any hospital you're working, they have their own IRB. HIPAA is not here; it's in the US. It's basically IRB also overlooks this. You don't need to worry about that right now, but you have to make sure that there is inform. You are clearly defining what is informed consent. Either you are asking the person that their data, or either you're asking their relative for the data, or either you are giving consent as a physician if the patient is not conscious. Let's say for example, you're performing a study on coma patients, and you're just saying that if we give glucose to coma patients, what is going to be the outcome, or what is going to be the difference, right? Rather than giving normal saline, we give glucose. Let's say that, for example, this is your study. So now, who is going to provide consent for a coma patient? The patient cannot, and the relative of the patient is not going to be there 24 hours, so they cannot as well. Now the physician which is treating the patient, the consent goes to them. So these are different kinds of consent. Again, I don't want to confuse anyone over here, but these things you should clearly define. If you're going to define your consent properly, like which way are you going to take the consent of the study participant, then it will go to the IRB. The IRB is going to approve, it's going to check the data security, and then you're going to discuss the authorship with everybody in your team. I hope that is clear. My recommendation is to spend 2 hours a week consistently rather than pulling all nighters. Don't fear rejection, rejection of the paper. Don't fear about that. Consistently work for your paper. Do a well designed study rather than doing a lot of poor studies at the same time, and ask questions. Okay, whoever your mentor is, make sure to constantly irritate them with your questions, to constantly ask questions, to ask them what you are trying to do. uh, of course, if they've already explained it to you, then you have to do the work, but remember that you're not supposed to do anything by yourself. You are supposed to ask questions. Okay, so ask questions and be consistent, right? There are some challenges. You have to manage your time and focus on data paralysis. It's basically trying to do not. Uh, basically, what we mean to say is time management is that you have to balance your rotations, your studies with research. Okay. Data paralysis means that if you're doing research and your data is scattered or there is something wrong in the data, don't try to manipulate it by yourself. That if there is no value, some, let's say for example, one value is missing and you just put something else in that place, don't do that. Try to be honest with the data as much as possible, because there are going to be editors that are going to review this. So it's better that you are honest with your research paper, or else it's just going to get rejected again and again. And any paper that is rejected 3 times, it's not going to get accepted anywhere, especially if it's rejected 3 times in 3 different papers. Right? Time management is uh, a very long subject. It's a very big subject. It's different for everybody. But I guess when we're going to have our Q&A session, you are going to understand that what basically I recommend for time management. Right now, this is a small difference. There's clinical research and there is bench research. Clinical research is what we do and what we know about case studies, retrospective charts, surveys, patients. Bench studies are basically animal studies, models. Histopathologists and pathologists are concerned with this, but I have mentioned this here just so that you have the knowledge, right? If somebody asks you what this is, so you should have the knowledge for this. But we are more concerned on the clinical side of the spectrum. So start with a clear researchable question. I have a video on this. Uh, I'm going to post it soon on our YouTube channel. If you've not subscribed to that, please subscribe to it. I have a video on this where we are showing live how to create a research question, how to search for a research topic, live demonstration. So watch that video. And mentorship is your most valuable asset. You have to first, you know, communicate to the mentor that will you be available for me 24 hours, will you be available there. Of course you want to use the person 24 hours, but you have to ask them, you have to communicate to them that will you be there, will you be what can I say, will you be consistent, will you be devoted to me. That's what you have to ask before purchasing any kind of mentorship. And don't skimp out on this. Always look for good mentorship. It's going to get you a long way. Unfortunately, we don't have the ethics to understand what value mentorship brings, but it is quite valuable. Ask the people that have gone through mentors; they're going to tell you. And always care about the IRB. Your paper, if it passes IRB, it's going to get published. It has more chances of getting published because the people sitting in the IRB are editors for basically good journals. I'm not talking about Pakistani IRB people, right? I'm talking about people if you go outside or even in Pakistan, let's say if you're performing a research and it goes through IRB smoothly, those people are editors somewhere else. So make sure that IRB passes and IRB is upheld, and make sure that you're persistent in your approach. Okay. So now we're just going to take some of your questions and just going to answer some questions here. So I'm going to stop sharing the screen now. Right. So any questions you guys have, you can unmute yourself and share your questions. I'll rather just share the screen because it was looking good. Right. So anybody has any questions, you can just unmute your mic and ask. And if we run out of time, we can just send in you another link. Can we do it alone or group making is essential? Well, it depends on the study, right? If you are doing letter to the editor, uh, if you're doing letter to the editor, then you can do it alone. But if you're doing a meta-analysis, I mean, you have to obviously have a team for that. You can do meta-analysis alone as well, but it requires you to be skilled in everything, which I think it's quite difficult. What do you think is the best way to find mentor? Again, I think you should go for the institutes or organizations that are not very famous, right? Don't go for the very famous ones. Go for the middle tier ones and go where you are communicating with the mentor. Like you should talk to the mentor on call if it's possible for like 30 minutes to 40 minutes and ask him every kind of question. And if you think he's the right guy, then you should go for that person, right? You should not go for the mentors that are not allowed to interact with you and in any very famous place. And don't go for that. Okay. How to start research? What's the first step? Well, I just told you that you are supposed to learn about research, right? You're supposed to understand what it is. You have to first pick out the study method. What do you want to do? You want to do the cross section, you want to do an SRMA, you want to do case study, case series. Once you pick that out, then you go for the research topic. Once you go for the research topic, you look for a team, you look for your whoever you want to incorporate in your team, and then you want to look for a mentor. Once you have the topic, the team, you find the mentor is going to guide you. Do you provide mentorship? Well, I it's not a it's not a formal research mentorship. I provide an all-inclusive mentorship, including the USMLE part and the research part, and I give opportunities to people that are close to me. I give them research opportunities specifically. I guide them. I teach them. So it is an all-inclusive mentorship. It's not specifically for research, but to answer your question, yes, I do provide that one. I also help you out in exams and every other thing as well. Any other questions, guys? Did you understand the presentation? Was it good, bad, average? What's the easiest form of research to start with? Uh, well, the easiest form of research to start with is letter to the editor, but I don't recommend that. I think you should go for cross section. A cross section is very easy to start with. Tried reaching out to people for opportunities on LinkedIn. It hasn't worked so far. What else can we do? Well, you can reach out to your seniors. You can reach out to the seniors working in your hospital, and you can just reach out to people that you know, professors, your teachers. Go to them, tell them I want to do research. Reach out to your seniors, reach out to people on Instagram, keep reaching out people on LinkedIn.